Hey everyone, it's Jenna. Today, we're talking about something that can be a little nerve-wracking for any healthcare professional: IV insertion. It's a skill that takes practice, patience, and a whole lot of confidence. This isn't a how-to for beginners, but a guide to help you refine your technique and approach every stick with the calm assurance your patients deserve. Let's build that confidence together. First up, preparation is everything. Before you even walk into the room, verify your orders, grab all your supplies, and I mean all of them. Don't forget that flush and tape. And perform thorough hand hygiene. Once you're with your patient, like Marcus here, confirm their identity and get their consent. Make them comfortable, explain the process, and maybe share a quick, calming story. A relaxed patient often means more cooperative veins. Your confidence starts before the needle is even uncapped. Now, let's talk assessment. Finding the right vein is part art, part science. Good lighting is your best friend. Don't be afraid to use a warm compress, it can work wonders. Feel for that bouncy, resilient vein. Don't just rely on what you see. Think about patient positioning. Is their arm supported comfortably? Are you positioned ergonomically to avoid straining? Small adjustments can make a huge difference in your control and success. Remember to keep talking to your patient. A simple, "How are you doing, Marcus?" can help ease their anxiety and yours. Okay, let's get into the technique itself. Your posture matters. Stand or sit in a way that gives you stability. Anchor that vein firmly but gently. A smooth, deliberate insertion is key. No sudden jabs. It's a finesse move, not a power move. And communication is a two-way street. Let your patient know what to expect. You'll feel a small poke now. If you're working with a colleague, use clear cues. A simple nod or "I'm ready" keeps everyone on the same page and reinforces a team approach to patient safety. What happens when things don't go as planned? It happens to everyone. The most important thing is to recognize early signs that it's not working, like a flashback that stops, or swelling. Stop immediately. Don't dig around. It's not a failure, it's a professional judgment call. Retract, apply pressure, and comfort your patient. Reevaluate your approach, or don't hesitate to ask a colleague for a second look. Escalating is a sign of strength and puts patient safety first. After a successful insertion, your job isn't done. Secure that line properly, monitor the site for any issues, and document everything clearly. Fostering a culture of safety means learning from every experience. Practice on simulation arms, seek feedback from mentors, and remember that every attempt, successful or not, is a learning opportunity. You've got this. Thanks so much for watching. Building confidence is a journey, not a destination. If you found this helpful, give it a thumbs up, and be sure to subscribe for more content to support you in your amazing work. See you next time.